Okay, if I record for an assignment here, this is just for educational purposes only?
Yeah.
Perfect, thank you.
Of course.
So I'm just going to explain a little bit about how pain works, as you are someone who experiences chronic pain, correct?
Yeah.
You've been experiencing chronic pain for about like 6 months?
Yeah.
All right, so I'm just going to take you through 9 cards. It's going to just educate about the process of how pain works, as even educating can alleviate some of the pain symptoms alone for someone who's having chronic pain. So this first picture kind of shows what we think of when we think of pain. It's a picture of somebody stepping their foot on a nail.
Mm-hmm.
So this card shows our nervous system. We are chock filled with all of these nerves. If you laid them all out, they're equating about 45 miles, just ready to sense all of these touches and temperature and pain. Kind of like stepping on a nail tells our brain that there's danger, takes our foot off the nail.
Mm-hmm.
So with this next slide, it kind of depicts, because we have all of those nerves, we have a baseline level of function of our nerves where it's always a little bit buzzing, if you will, and that's at the bottom. At the top, there's this firing level, and that's where you would experience pain. So with this next slide, looking back at this analogy of stepping on that nail, you have your normal excitability of your nervous system. You step on that nail, it goes up to a messaging firing level. So the good thing about, tissue damage is that will also recover. It'll go back down to its functioning level.
Mm-hmm.
I know I'm going through it kind of fast. Do you have any questions so far about what I'm saying?
I don't think so. I think I'm following.
Okay, perfect. So with someone with chronic pain, how we talked about how someone was having like a regular physiological level of pain at the bottom,
Mm-hmm.
you can see there's like an extra sensitive level of functioning that's really close to the firing level.
Mm-hmm.
So much close to that firing level that like standing for long periods of time, or like even going up and down the stairs, doing something simple can cause you to reach that level very quick. And it gives you this perception of you're very quick to have pain.
Mm-hmm.
And this slide just kind of compares how there is people with a low level, and you can kind of, over time with chronic pain, you can have your baseline be close to the top where it just takes a little room for activity for pain to occur.
Mm-hmm.
So thinking about another analogy, thinking about like a house alarm or a car alarm, it takes a lot to sound those off. It takes breaking a window, it takes busting down the door. But if the system is really elevated, it could just be a leaf that causes the alarm to go off.
Mm-hmm.
So then you think about for yourself, like, why is my baseline level so high, so elevated? And remember, tissue damage, it gets better. Tissue damage doesn't cause like chronic pain. So you have to think about other factors, and that's kind of what this slide is depicting. It's looking at other like yellow flags, like cautionary symptoms that you could be experiencing. Like in this slide in particular, it's saying like failed treatment, job issues, fear and anxiety, and that could be the cause for this person to have an elevated level of pain.
Mm-hmm.
Does that make sense?
Yeah.
Do you have any questions so far about this?
No.
So what I would do is we would work on alleviating some of those stressors in your life, those symptoms that are giving you an elevated level of pain, and then we would work on that, and then go off and do the exercises. So definitely focusing on getting that baseline level down.
Mm-hmm.
Does that make sense?
Yeah, that
Awesome.
makes sense.
Awesome. So we'll work on that, and then we can work on some exercises.